Hi everyone, my name is Jasmine Chatelain. I'm a midwife in Canada and I have worked with the Canadian Association of Midwives and the National Aboriginal Council of Midwives for the past year on a project around immunization. Today I'm going to give you a brief PowerPoint presentation to summarize our project and share with you some of the things that we learned and some of the things that we produced as part of this project. I will be sharing my screen and also going online a little bit during the presentation, so I'll ask that you be patient with my fiddling. I will share my screen now. Okay. So our project is called Midwives and Vaccination, Delivering Informed Choice Discussions. In 2018, the Public Health Agency of Canada commissioned some research to look into various healthcare providers' views and experiences with vaccine hesitancy, which included surveying midwives. What they found as part of that research was that midwives, more than other types of healthcare providers, encounter vaccine hesitancy with their clients, and also found that discussing and working around immunization was challenging and that they lacked confidence in how to talk about or work around immunization, particularly with clients who might be vaccine hesitant. So as a result, the Canadian Association of Midwives, or CAM, and the National Aboriginal Council of Midwives, or NACM, in tandem with the Public Health Agency of Canada, or PHAC, decided to run a project that would investigate a little bit further where that was coming from and see if they were some things that we can do to support midwives in this work. The project was overseen by a midwifery advisory committee, which was made up of 6 midwife members from various provinces across Canada, including 1 representative from NACM, who were selected based on applications that showed enthusiasm and specific knowledge around immunization. The CAM Board of Directors and the NACM core leaders were also directly involved with this project, including final approval of a position statement and the end materials that the project produced. And the project was coordinated by myself, the project's project officer, which also included creating the content for the materials this project produced. We had 4 basic objectives for this project. The first one was to simply gather information. We wanted to know a little bit more around the existing legislated competencies and scopes of practice around immunization for midwives. We wanted to know what midwives are actually doing in their day-to-day work with clients around vaccination, including the informed choice discussions they might be delivering, vaccinating and or vaccinating in clinic. To a much lesser degree, we investigated a little bit further into midwives' attitudes, perceptions, and challenges around immunization in their role as midwives, and what kinds of informational materials CAM and NACM might be able to produce that would be supportive and helpful to midwives in their work with clients around immunization. We also wanted to gather some information from midwifery clients themselves. We also wanted, to a lesser extent, to gather information from midwifery clients about their actual experiences with midwives, whether they and their midwives had discussed immunization or if they had been vaccinated by midwives. And again, to a lesser extent, a little bit around their attitudes, perceptions, and challenges around immunization. And finally, what kinds of informational materials they might find helpful. Our second objective was to, in general, help to increase and improve midwifery capacity and services around immunization. 3, to create informational materials. And 4, in all of our project activities, including the creation of informational materials, to specifically look at and address Indigenous people's needs. So the activities were basically threefold. The first one was a needs assessment or community consultations to gather information and to inform the production of materials. Secondly, to create a position statement, and finally, to create some materials. First of all, for the needs assessment, I'd like to be clear that we did not perceive the needs assessment that we did to be officially, technically high-level research. It was more of a general way of consulting with midwives and midwifery clients. So the first thing that we did was an online survey produced in French and English and made available Canada-wide. It was approved by an ethics review board. We were very excited to receive an overwhelming response. Over 2,400 midwifery clients responded to the survey, except in Northwest Territories and Prince Edward Island. Almost 5% of the respondents identified as Indigenous. As well, in the survey, there were places for people to leave additional comments, and there were 850 additional comments that were left. 320 midwives responded to the survey from every province except Newfoundland. 9.2% identified as Indigenous, and midwives left over 500 additional comments. We used Simple Survey to create the survey and to analyze the survey, and we cross-tabulated answers for Indigenous respondents and by province. We also conducted focus groups, and I should add here that we were in the middle of conducting focus groups when COVID and the subsequent initial lockdown arrived. So we were unable to conduct as many focus groups as we wanted to. We took a pause, of course, when COVID arrived, and then decided not to start them up again, feeling that it was unrealistic and maybe even unethical to ask midwives to be distracted from their work during COVID. So the results that I'm sharing with you show lower participation levels than we were originally targeting for. Before COVID, we hosted focus groups that were both in person and online, and talked to and did focus groups in British Columbia, Manitoba, Ontario, and Quebec. A total of 54 midwives attended, one of whom was Indigenous and 2 of whom worked in Indigenous communities, even though they themselves were not Indigenous. Only 6 midwifery clients joined us, with none of them being Indigenous. The way that we analyzed what was discussed during these focus groups, which I should add was anonymous, was 2 different midwives, myself and another midwife, separately looked at the transcripts of the discussions and collated and analyzed them for themes, and then came together to confer and come to a consensus around what we thought the general themes were that were emerging from the discussions. I'd like to note that care and attention was put to reaching out to Indigenous peoples to participate in the focus groups. We created groups exclusively for Indigenous midwives and clients in the hopes that a safe space to share might be motivating, and we directly reached out to Indigenous communities to participate. I am unsure as to why the participation level was low from those communities, but it's something to keep in mind. It says here on the slide, key informant interviews. I did not conduct official key informant interviews like you would as part of research. I did want to share, however, that I spoke to several people working at an institutional level, including midwives, pediatricians, obstetricians, health educators, immunization researchers, communication specialists, including Indigenous communication specialists, and with some people who identify as vaccine critical, just to get some information and perspectives from a more institutional level. What were the results of our needs assessment? For the midwives, there were 4 key messages that we kept hearing, and they were: a majority of midwives support vaccination, the midwifery knowledge, competencies, scope of practice, and actual practice or practice management vary widely from integrated to non-existent. Almost all midwives, regardless of their scope or knowledge, feel that they need more education around immunization. Almost all midwives believe that offering vaccines is important from an access perspective, although not necessarily realistic, depending on the province that they worked in. And most midwives shared that delivering informed choice discussions around immunization can be problematic and is challenging. More specifically, over 75% of midwives think that the overall benefits of vaccination outweigh the risks. 70% strongly agree or agree that vaccination should be part of scope of practice, and about half strongly agree or agree that they would like to be able to vaccinate infants. For those of you who are not familiar with the midwifery model, as it stands right now, most provinces in Canada, midwifery care ends at 6 weeks postpartum after the midwife has primary care management for postpartum parents and newborns. In relation to informed choice discussions, what we learned was that the routine inclusion of informed choice discussions, or ICDs, on immunization varies in midwifery practice. Approximately half of non-Indigenous and a quarter of Indigenous midwives strongly agree that providing clients with comprehensive information on recommended vaccinations of pregnancy is a necessary part of client decision-making. However, approximately only 5 to 25% of midwives feel confident in their ability to provide an adequate ICD on immunization. Some of the reasons that midwives cited for this lack of confidence were gaps in knowledge, discomfort with the topic itself, fear of client reaction or of undermining the midwife-client relationship, specifically the trust that midwifery clients place in midwives, feeling it is not appropriate to the midwife's role, feeling like they have a lack of access to primary evidence, a lack of comprehensive midwifery vetted evidence-based information, and feeling like if they were to raise questions or express concerns around immunization, there may be repercussions from other midwives or other healthcare providers. In terms of informational materials, almost all midwifery respondents said that they would really like some education around immunization, particularly how to communicate about immunization using an informed choice approach, and how to communicate with vaccine hesitant clients. They were looking for informational resources, both for themselves and for their clients, including vaccine critical ones. Midwives really would like a clinical practice guideline put out by midwives around immunization, specifically vaccination and pregnancy. And midwives would appreciate a midwifery created, detailed, comprehensive client handout, specifically delivered in a neutral tone with equal focus on vaccine benefits and risks. They also asked for tools for clients to help with decision-making and understanding or evaluating scientific research and internet information. The format that they expressed wanting more than anything was something that could be online. However, it could also be downloadable and printable. It is important to note that Indigenous responses clarified that not all remote or Indigenous communities have consistent access to the internet. So being able to have something that can be printed and handed directly to clients is important for those communities. And Indigenous midwives or midwives working with Indigenous communities really underline the need for accessible concepts and language, and to upfront include information around Indigenous history of infectious diseases and vaccination in any informational materials, both for Indigenous clients and for non-Indigenous clients. From the clients, the key messages that we heard were 60% of respondents vaccinate in pregnancy. Now, it's important to note that obviously respondents to our survey are self-selected, and so it may very well be that this percentage does not reflect the percentage of all midwifery clients, just those who chose to respond to our survey. Most clients want to discuss immunization and would like to receive vaccines with their midwife. Client experiences of immunization services with midwives vary from very comprehensive to non-existent. Clients overwhelmingly trust midwives to deliver balanced ICDs on immunization. And clients in general do not feel like they have sufficiently comprehensive information with which to make immunization decisions. Half of midwifery clients have discussed immunization with their midwife, and about 3/4 of them received information from other healthcare providers as opposed to their midwives. About half of them strongly agree that immunization discussions that they had with their midwife were effective, and about 75% of them felt like the discussion was respectful of their perspective. They either reported having had or being able to assume that they would have better discussions with their midwife than with other healthcare providers, citing reasons such as, again, the midwifery client or the midwife-client relationship, particularly the level of trust that clients place on their midwives, having adequate time to discuss immunization, not feeling coerced or pressured by their midwives to make particular types of decisions, and because of the high quality of informed choice discussions that they can expect. There was an overwhelming yes from midwifery clients to wanting more information, more discussion, and being able to be vaccinated in clinic with their midwives. Around informational materials, midwifery clients asked for more detailed and unbiased information with equal focus on components or ingredients, risks, and adverse events as on benefits. They would very much like a midwifery produce detailed, balanced, and comprehensive handouts on the vaccines in the perinatal period and vaccines in infancy and childhood. They wanted a resource list, and like the midwives, they wanted something that could be online but downloadable and printable. Before I go on, I should mention that something that they came up with over and over again was that the immunization topic most important to them was vaccination in pregnancy and then child and infant vaccines, even though midwifery care tends to end at 6 weeks postpartum. The second activity that we did was to create a position statement. This was very much created by the Midwifery Advisory Committee, then reviewed and revised and approved by the CAM Board of Directors and NACM core leaders. It was then circulated to all CAM members for feedback, including an online survey. And I'd also like to note that this position statement has been created and is being issued jointly by CAM and NACM. In preparing or in creating the position statement, our goals were to look at immunization through a midwifery lens, to create an advocacy tool for increased midwifery participation in immunization research, policy making, and service delivery, and to contribute midwifery's unique knowledge around how to find balance between increasing consumer access and knowledge around immunization while respecting informed choice. This is just a slide to show you what the position statement looks like. Later in the presentation, I will be talking about what information we have available publicly and how to access it. In a quick summary of our position statement, I'd like to just cover the rationale, principles, and recommendations that the position statement puts forth. Basically, the rationale for this position statement was that safe and equitable access to vaccine information and services is a human right, and that reducing ill health from infectious diseases helps to reduce health inequities among population groups. Providing immunization information and administering vaccines is appropriate to the midwife's role, and that midwives are well positioned to discuss immunization. The position statement's principles are promoting wellness and normal, informed choice, client active engagement in their own care and decision-making, access, transparency, and cultural safety for Indigenous, Black, and racialized peoples. Recommendations included pre- and post-service education for midwives, including immunization knowledge as a competency, and including Indigenous, Black, and racialized peoples' historical and current experiences with infectious diseases and vaccination and public health in all immunization education for midwives. Around scope of practice, I think I'd like to preface this by saying that the creators of the position statement are well aware that scope of practice varies widely across provinces, and that midwifery capacity to discuss, vaccinate, and or vaccinate in clinic varies widely, as desire might as well. And this position statement is written with that awareness in mind. And if you go along to read the whole position statement, you will see some sentences clarifying that. So recommendations for scope of practice around immunization for midwives was for midwives to be responsive to community needs around immunization, that informed choice discussions, vaccine prescription, and administration for the recommended vaccines of the perinatal period should be in midwifery scopes of practice, that there needs to be political, logistical, and financial support to establishing vaccine administration in midwifery care settings, should midwifery practices choose to do that, and that midwives should be given some space to participate in the design and implementation of vaccination initiatives, programs, and policies nationwide. Recommendations include particularly for best practice or practice management for midwives following better education, that immunization record keeping and adverse event following immunization reporting should be part of midwifery practice management. that we join other healthcare professions in calling for nationalized, coordinated, and timely vaccination schedules, data collection, and adverse events following immunization reporting, including race-based data. We recommend continuing research on immunization safety, including looking at risks of vaccines. And we recommend that there is midwifery-led research or participation in developing immunization research priorities. The position statement recommends that there is transparent, accessible, and referenced immunization information from public health agencies and the medical community, and that there is interprofessional collaboration promoting informed choice and respect for client decision-making around immunization. Our third activity was to create informational materials. So I'm going to be showing you some examples and spending a minute looking online with you, looking at the general slogan and look and feel of our informational materials, a general poster that we made, two posters that we made that I'm calling decision-making posters, but are really posters just calling to attention some things that people may want to take into consideration when making decisions about vaccination. And then handouts around the same idea, some web pages that we've created, and a social media campaign. Our slogan for the informational materials is vaccines, we can talk about it. And you can see here by looking at examples of our general poster that our kind of general look and feel was to include obviously images that people from various sectors of the population could relate to or identify with. We chose this slogan as a way of supporting open social discourse around immunization, prompting midwives to talk about immunization with clients, and encouraging clients to ask their questions around immunization. For the decision-making posters, we created two, one for non-Indigenous people and one geared towards a more Indigenous audience, although obviously both posters could be posted anywhere. This one that you're seeing is a sample of the general one, and you'll see here on top of the images of different people, it says the science, my context, and me and my family. So that's to draw attention to considerations or ways of thinking when it comes to evidence-based decision-making. And we wanted to highlight the top 5 questions that parents shared with us in our needs assessment. Number 1 being infant and child vaccinations, vaccine ingredients or components, safety, vaccine safety and unknowns, vaccine risks and reactions, and the Indigenous, Black, racialized, and I'm going to need to read it, Two-Spirit LGBTQIA history with public health in general. The poster that I just shared with you is also being used as the front page of a client handout that midwives can share with clients. And what you see now is what the clients will find on the back page, which just delves a little bit more deeply into the 3 components of evidence-based decision-making. So science, contextual information or evidence, and personal information. We included in here prompts around what kinds of questions might allow parents to know whether they can trust the information that they're reading, to help clients think about their own personal circumstances, so where they live, what their personal history is, but also their community circumstances, and individual needs for making a decision. You'll see here a sample of the decision-making poster geared towards an Indigenous audience, which just really upfront identifies and acknowledges that there has been a problematic and at times negative experience for Indigenous peoples around infectious diseases and immunization and public health measures, and that it is important for care providers and people to acknowledge that history and that possible lack of trust in order for Indigenous peoples to feel safe and supported around their immunization decision-making. The handout version of this poster is different than the one geared towards a more general audience. It repeats the acknowledgement around Indigenous experiences. It also highlights the capacity within Indigenous communities for wellness and resilience, and it situates it within a community perspective, tagged with the line here, Alma relations, which is an Ojibwe term, but used by many Indigenous communities to reflect an outlook that everything, humans, plants, animals, the planet, are interconnected and interrelated. The backside of the handout is simply a place to write notes, and with some prompting questions, or particularly around practical information. For example, how do I keep track of my vaccines, or where can I get information? This really comes as a result of talking to Indigenous midwives and people at an institutional level who highlighted the need for support to help Indigenous peoples know what kinds of questions they can ask when they are in an appointment with a midwife, and literally a place to store the information that, that they can carry around with them. We also created some web pages around immunization, and at this point I'm actually going to go to the specific web pages. So if you'll just bear with me while I stop sharing my screen. So on the CAM website, we have created web pages for the public and for CAM members or midwives only. I'd like to note that if you go onto the NACM website, there will be a banner on the home page there that if you click on it, automatically brings you here. You will see on this public-facing website that we have a copy of the position statement, which I just spoke about. We have an overview of the project and a summary of our needs assessment, which goes into more detail than I have done in this presentation. You will see something called resources. So if I click on resources, I'm hoping that you will be able to see it. We have created a resources list for the public and for midwives, and you can see here it's very extensive. We've got 20 sections in the public resource list that ranges from websites for governmental agencies to general information around infectious diseases and vaccines, And then specifically influenza and pertussis, which are vaccines that people may choose to have in pregnancy. A little bit of resources on tuberculosis, mostly for remote and Indigenous communities. And then some more detailed resources around, again, the influenza vaccine, the Tdap vaccine, vaccine components, adverse events following immunization. We have sections on resources around informed choice, what some provincial regulations are around reporting or vaccinating, and then information around some provinces that have exemptions to vaccine reporting and regulations. We have a section on understanding research and identifying misinformation on the internet. There are resources geared towards Indigenous content in all of these sections, but there is also a standalone section on Indigenous information. And then there's information around what midwives are expected or are allowed to do around immunization. The other thing that you'll see on this public-facing website is on the homepage, we have actual immunization content. And that is also extensive. You'll see we also have 20 sections. And I just like to say, you can see for yourself by going on this webpage, but although much of the content is similar to what you will find on other websites, our goal, and we worked very hard to achieve this, was to provide the context in such a way that it had a balanced and respectful tone, that it spoke as much about risks or reactions or associated with vaccines as benefits, and data that we've compiled around the safety of vaccines. We included and acknowledged unknowns, things that we don't know about vaccines, and with a focus on, again, influenza and the Tdap vaccine, because those are the ones that pregnant people may choose to receive in pregnancy. We also chose to include information around general immunology, infectious diseases, and public health, just for general education. And we included practical information for parents around how they can keep track of their vaccines, how they can report adverse events themselves, that kind of thing. The other thing that you will see here if you are a midwife is, I'm going to stop sharing the screen and go to the next ones. You will also see a resources for midwives, which includes specific information around existing clinical practice guidelines, manuals, education sources, educational resources for midwives if they want to take the initiative to learn more, and then some more high-level technical or clinical information coming out of studies, as well as the actual forms that they can use to both report adverse events or to have clients fill out if clients are choosing to apply for an exemption in provinces where some vaccination is mandatory. I'm going to stop my screen sharing again and go back to the PowerPoint presentation here. And here we are. So if you would like to check those pages out in detail, here's the URL. CanadianMidwives.org, which is the homepage for the CAM website /vaccines. If you are a CAM member and would like access to the members only resource list, then you will have received a members only password to see that page. Finally, I would like to just share with you that we have started phase 2 of this project, which will be going on into the spring, also funded by the Public Health Agency of Canada. And the goal there is to create an educational model for midwives and Indigenous models that can both complement existing courses on vaccination, but will also have 6 sections targeting specifically how to build or offer an informed choice discussion that includes evidence and best practices around immunization through a true midwifery informed choice lens. Should any of you have further inquiries about this project, or if you would like to order any of these materials, Emma Sandona is the CAM project officer working on this project now, and you can see here her email is esandona@canadianmidwives.org. I'd like to mention that all of these materials were mailed to midwifery practices, provincial midwifery associations, education programs, colleges, as well as some other healthcare provider associations and colleges. Thank you very much for watching this presentation. I hope it was useful, and I hope you use some of these materials.